I'm going to be your nurse today. I've shut the door for some privacy, and I'm here to do your physical assessment. I'm going to wash my hands. Can you tell me your name and date of birth?
Yes, my name is Emmy Jones. My date of birth is 12/26/01.
Do you have any allergies?
No, ma'am.
Okay. Do you know what town we're in?
Marion, Kentucky.
Do you know who the current president is?
Joe Biden.
Okay, the patient is alert and oriented times 4. I'm just going to get your vital signs. You lift your sleeve up.
Okay.
Patient's blood pressure is 122/82. Are you having any pain?
No.
We're going to feel your pulse.
Okay.
Patient is breathing 16 breaths a minute and their pulse rate was 84. They are having no effort of breathing and their pulse was even and regular. I'm going to look at your skin.
Okay.
Match your legs. Okay. The patient's skin is warm, dry, and intact. The color is appropriate for their ethnicity. I'm going to pinch the top of your hand. There is no tinting. The capillary refill is less than 3 seconds. The patient's head size is appropriate for their body size, and the head is normal cephalic shape. I'm going to put my gloves on.
Okay.
I'm going to feel your scalp.
Okay.
Patient's scalp has no lesions, masses, abnormalities. There's no flaking. Are you having any tenderness on your scalp?
No, ma'am.
Okay. I'm going to feel your temporal artery. Temporal artery is palpable, it's 2+. I'm going to feel your frontal sinuses and your maxillary. You having any tenderness in your sinuses?
Nope.
Okay. Can you raise your eyebrows? Can you smile? Frown? Blow your cheeks? Cranial nerve 7 is intact. I'm going to go ahead and look at your eyes.
Okay.
So the patient's eyelashes and eyebrows are evenly distributed across the eyes. The external structures of the eyes, there's no abnormalities, no masses, no lesions, or any redness. Just look straight at me. I'm going to shine this light in your eyes. The pupil size is a 5+. Okay. Now look at this. Okay. Now just follow it with your eyes. Patient's pupils are equal, round, reactive to light, and accommodating. Cranial nerves 3, 4, and 6 are all intact. Look at your sclera. Okay, the conjunctiva are pink and moist, and the sclera of the eyes are white. We'll look at your ears. Do you have any tenderness on your ears?
No.
Patient's ears and all features of the face are symmetrical in the face and midline. The external structures of the ears have no abnormalities, no drainage, no redness. I'm going to have you cover up one of your ears. I'm going to whisper a word behind you and you
Okay.
tell me what you hear.
Popcorn.
That is correct, and I would assess that bilaterally. And that means cranial nerve 8 is intact. Okay, I'm gonna look at your nose. Have you ever had nasal surgery or broken your nose?
No.
So the nose is symmetrical and midline. The nasal mucosa is red and the nasal septum is not deviated. Now I'm gonna have you occlude one of your nostrils and close your eyes and tell me what you smell.
Alcohol.
That is correct. So I would assess that bilaterally. Cranial nerve 1 is intact. Okay, can you open your mouth for me? Can you say ah? Okay, patient's tonsil size is a 1+. Their oral mucosa is red and moist. There are no lesions or abnormalities. Patient has all 32 teeth intact and they're all in good condition. External lips, there are no masses or lesions. Can you stick your tongue out? Patient's tongue is pink and moist. Can you move it from side to side? Okay, and can you swallow for me? Cranial nerves 9, 10, and 12 are all intact. I'm going to look at your neck. There's no jugular vein distension and no visible pulsations of the neck. I'm going to feel your carotid artery. Carotid artery is a 3+, and I'll assess that bilaterally. I'm going to look at your trachea. The patient's trachea is midline. Can you move your head like this? The patient has full range of motion of the neck and they're able to easily control their head. Okay, I'm going to have you stand up for me. Okay. Tell me if you feel any tenderness. Okay, there's no tenderness or any masses or lesions. The patient has no increased effort of breathing. I'm going to listen to the lung sound. 1, 1, 2, 2, 3, 3, 4, 4, 5, and 5. There are no adventitious lung sounds present, and I'm going to listen to the heart sounds. So the second intercostal space on the right sternal border is the aortic valve. Second intercostal space, left sternal border, is the pulmonic valve. Erb's point is the third intercostal space on the left sternal border. The tricuspid valve is the fourth intercostal space on the left sternal border. And the mitral valve is midclavicular on the left side in the fifth intercostal space, and I'm going to listen for 1 minute. Patient's pulse rate is 86. It is regular and normal sinus rhythm. I'll have you turn around for me.
Okay.
Do you have any tenderness?
No.
Okay. You take a deep breath. Patient's chest rises and falls symmetrically. I'm going to listen to the lung sounds on the back.
Okay.
1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, and 9. The patient has no adventitious lung sounds anteriorly or posteriorly. Okay, you can go ahead and sit down. Okay. Can you stick your arms out straight? Okay. The patient's arm length and size is symmetrical. I'll have you do this to each finger. Okay. Patient's fine motor skills are intact. Can you grab my hands and squeeze? Patient has equal grip strength of 5 plus. Now push against me. Now pull. Wrist strength is a 5 plus. Now do this. Push. And pull. Patient's arm strength is a 5 plus as well. I'm going to assess the range of motion of the wrist. So can you do this for me? There's no crepitus, no tenderness, no swelling. The patient has full range of motion of the wrist. I'm going to assess that bilaterally. Can you do this with your elbow? Patient has full range of motion of the elbow, no crepitus, no swelling, no tenderness. I'm going to assess that bilaterally. Okay. Can you do this with your shoulder? Okay. No crepitus, swelling, tenderness of the shoulder. It has full range of motion. I would assess that bilaterally as well. I'm going to feel your pulses on your arm. Radial pulse is a 3 plus, is on the thumb side of the wrist. Brachial pulse is a 3 plus as well, and I would assess those bilaterally. Okay, can you lay down for me?
Yes.
Okay, what was your last bowel movement?
This morning.
Okay, and are you having any trouble urinating?
No.
Okay, the patient's abdomen is flat and non-distended. There are no visible pulsations of the abdomen. I'm going to listen to the vowel sounds. Found the belly button. And start in the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. The patient has normal active vowel sounds. If I heard no vowel sounds, I would listen for 5 minutes in each quadrant before saying that the patient has absent vowel sounds. Okay, you can go ahead and sit back up for me. Good. Okay. I'm going to put my gloves on, and I'm going to look at your feet.
Okay.
The tops of the feet, the bottoms of the feet, and in between the toes have no lacerations, no abnormalities. They are warm. There's no edema of the lower extremities or the feet. Now I would assess this bilaterally. I'm going to feel for the dorsalis pedis pulse. It is palpable 2 plus, and the posterior tibial pulse is on the inside. It is palpable in a 2 plus as well, and I would assess that bilaterally. Okay, can you push against my hand like a gas pedal? Okay, ankle strength is a 5 plus. Can you pull back? Okay, that is 5 plus as well. Now can you kick out and pull back? Leg strength is a 5 plus, and I would assess strength bilaterally. Now can you do this with your ankles? There's no crepitus, no swelling. The patient has full range of motion of the ankle, and I would assess that bilaterally. Can you kick out? And can you bring it in too? Okay. Patient has full range of motion of the knee, no swelling or tenderness, and no crepitus. Okay, can you stand up?
Mm-hmm.
Now can you kick your hip out and in? Okay, patient has full range of motion of the hip, no crepitus, no swelling, no tenderness noted. Okay. Can I get you anything else today?
No, ma'am.
Okay. I'm gonna just go document this. And thank you.
Thank you.